नमस्कार, स्वागत है आप सभी का पीएम eVidya चैनल में। और इस वक्त हो रहा है वक्त शाम के 5 बजे, यानी कि समय हो गया हमारे खास सेशन जिसका टाइटल है सहयोग। And as you all know, through these sessions, we continuously try to enhance the well-being, the mental well-being of our viewers and try providing psychosocial support as well to all our viewers during any hard times. तो आज का जो हमारा टॉपिक है जिस पर हम बात करेंगे, जिस पर हमारी कॉन्वर्सेशन रहेगी, वो है अंडरस्टैंडिंग एंड अवॉइडिंग टेम्पटेशन फॉर स्मोकिंग, ड्रिंकिंग, ड्रग्स एंड इंटरनेट एडिक्शन. एंड आई थिंक इट्स नीडलेस टू से हाउ डीप रूटेड ऑल दीज एडिक्शंस आर. तो इसी डिस्कशन पर, इसी कॉन्वर्सेशन पर जो आज हमारे साथ दो एक्सपर्ट्स भी जुड़ चुके हैं. फर्स्टली लेट मी इंट्रोड्यूस देम टू यू ऑल व्यूअर्स. सो वी हैव प्रोफेसर CG वेंकटेश मूर्ति. ही इज डीन ऑफ रिसर्च एट रीजनल इंस्टीट्यूट ऑफ एजुकेशन एट NCERT at Mysore. Welcome, sir.
Namaskar. Thank you.
We also have a practicing counselor, Mr. K. Ganesh Murthy, with us right now, joining live. So welcome, sir.
Thank you. Namaskar to all the viewers.
और हमारे दर्शकों में आपसे कहना चाहूँगी कि हमारा ये सेशन, हमारे सहयोग का सेशन पीएम eVidya के चैनल नंबर 6 से 12 पर लाइव प्रसारित हो रहा है. और साथ ही हमारा यूट्यूब चैनल जो कि है NCERT ऑफिशियल, उस पर भी लाइव स्ट्रीम हो रहा है. तो यदि आपका कोई भी प्रश्न हो, कोई भी सवाल हो, कोई भी क्वेरी, किसी भी तरह का फीडबैक हो, तो आप ज़रूर हमें कॉल करके पूछ सकते हैं या बता सकते हैं. हमारा फ़ोन नंबर है 8800440559 और हमारा ईमेल एड्रेस है sahayog@ncit.nic.in. और आप चाहें तो हमारी यूट्यूब चैनल, जैसे कि मैंने अभी बताया, NCERT ऑफिशियल, उसके लाइव चैट बॉक्स पर जाकर भी अपना कमेंट या कोई भी क्वेश्चन वहाँ पर ड्रॉप कर सकते हैं. तो आज का जैसा कि मैंने टॉपिक बताया कि हम बात करने वाले हैं तरह तरह के एडिक्शंस पर. तो सर, मेरा सबसे पहला सवाल प्रोफेसर वेंकटेश जी से है. सो सर, व्हाई डू सम चिल्ड्रन टेंड टू स्मोक? क्योंकि स्मोकिंग भी आजकल एक तरह का एडिक्शन है. आई थिंक बहुत ही डीप रूटेड एडिक्शन है, नॉट ओनली इन यूथ, काफ़ी मतलब वर्ग में ये बहुत ही एडिक्शन है. तो सर ये इसके साइड इफेक्ट्स क्या होते हैं, और अगर सर ये जो स्मोकिंग की टेम्पटेशन है, इसको अवॉइड करने के लिए क्या किया जा सकता है?
बढ़िया. इसको समझने के लिए let us come to the slide number 3. Yeah, right. Addiction है क्या? What is this? Addiction basically is an inability to stop using a substance or engaging in a behavior even though it is causing psychological and physical harm. We will know, but we can't resist. That is called addiction. Now, today we have a plan to talk about 4 different kinds of such compulsions. In the first segment, we would like to focus on smoking. You have asked a question. Why do some children smoke? What makes them smoke? It is very important. I think we need to talk about it. Let's move on to the next slide. The issue is, why do some children smoke? Not that all children smoke. Some children resort to smoking. If you see the circumstances which facilitate children to get into smoking, you will find that their parents smoke, or the family members, they smoke there. Next is the friends who encourage them to try cigarettes and keep smoking. So there's a peer pressure and influence. Some children see smoking as a way of rebelling or showing independence. They think, I can do whatever I want, I can be independent, therefore I'll smoke. Kya hoga? Let me see. Some children also think that everyone else is smoking. They keep seeing many people who will be smoking, and they think that why should I not smoke? There are many teenagers who simply like to try new things without understanding long-term consequences. This is the bottom line. Nicotine is it's a feel-good drug without intoxication also. They feel very comfortable when they have that. There's such a good feeling, and they think that I can, continue with this. Next slide. So now, let us also understand what are the effects of smoking. If somebody starts getting into smoking as an addiction, it may have a lasting effect on adolescents and then the children for their brain development. This many youngsters don't realize. They may suffer from shortness of breath. There is reduced stamina. There is reduced lung growth. There can be early cardiovascular damage. There can be hypertension. Can also lead to certain types of cancer, which most youths don't realize. Depression and suicidal ideations can be a product of this. There can be behavioral problems within the family or at school, for sure, ultimately lending itself to poor quality of life. Next slide. Now, if you see how tobacco damages human body, which is very important, and youths and then the young children must understand. The nicotine narrows the veins and arteries. This can damage the heart by forcing it to work faster and harder. And there can be slow blood and reduced oxygen to feet and hands. If you take carbon monoxide, this is something, where the smoke has not completely taken off and it is a remaining part of that which can lead to carbon monoxide. It deprives the heart of the oxygen it needs to pump blood around the body. Over time, airways can swell up and let less air into the lungs. We should understand the consequences. There is also a tar, a sticky substance that coats the lungs like a soot in the chimney. We don't realize that, a black soot in the chimney. Next slide. Now, how does it damage the body? We are talking tiny particles in tobacco smoke can also irritate the throat and lungs and can cause something called smoker's cough. They keep on coughing. This makes one produce more mucus and it can damage the lung tissue. Why don't we understand these things? It can irritate the eyes, nose and throat. There can be cancer-causing chemicals which can make the cells grow too fast abnormally. This can result in cancer cells. We tend to see the pictures on the cigarette packets also. This can cause cancer. Very bad pictures. In spite of that, the youths and others tend to ignore that and want to get into that. Next slide. Now, it also affects the way we look. Many of us might not have understood this. It can cause yellow-brown stains on the fingers, tongue and teeth. It can also increase the risk of tooth loss and it can lead to bad breath. We don't realize this. And it can make the skin saggy and give early wrinkles. Make the hair also lose its natural shine. These are the other kinds of effects in terms of how we look if we are smokers. Next slide. Smoking prevention, therefore, is very, very important. They can be very effective when they are school-based or high-intensity programs. Schools must take proactive initiatives in making school prevention programs. Maybe as a part of the guidance, school guidance and counseling program, they should do that. And it becomes very, very intense when it is conducted by teachers or educators with proper training. Anybody and everybody cannot do that. It includes various strategies like lifestyle training, motivation enhancement, cognitive behavior approaches, blah, 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 blah. So, but then there can be very powerful prevention programs that we need to do. Next slide. So, there are ways to reduce the temptation for smoking. This is also our focus. How is it that they can reduce the temptation? First, get their views on the smoking is what we are. Let the children say, why do they smoke? Make a list of that. And then give them the facts. Adults have a responsibility to give them the facts. What are the consequences? What happens if you do this? Give them the facts and figures. Help them to make a plan to get rid of the temptation. There are different triggers for different people. And see what is the trigger point for this particular child. What can be done so that they can get rid of the temptation. Keep them away from those trigger points. Help them to implement their own plan. That is very important. Guidance counselors, teachers, parents, school, well-meaning friends, they all have a responsibility to help them to implement their plans and help them to monitor their own intervention and stay active. So throughout their plan and implementation of the plan, monitor how they are proceeding. Be their champion. Teachers and parents and well-meaning people and community, be their champion. Celebrate the success or their willingness to reduce the temptation and to give up the temptation. These are certain things about smoking. I hope you are able to hear me clearly. Can you hear me?
Of course, and thank you so much
Yeah.
for throwing some light on these topics, on this addiction. My next question is for Mr. Ganesh sir. So what is alcohol addiction, and why do children these days like to have alcohol? And again, what are its effects, and what can someone do or anyone can do to avoid the temptation for, for drinking?
Could you kindly move to the next slide?
Sure.
Yeah, so thanks for the sir to start up with and to start with the smoking. So next, when you see about the various different kinds of addictions, because the drinking is something which is prevailing more in the youth. So now people, before we seeing that what is that, and first let's try to understand what does alcohol mean. So an alcohol drink, it is a drink that contains ethanol. It's a chemical compound. So it's a type of alcohol which is produced by fermentation of grains, fruits, or other sources of sugar that acts as a drug. So that's why we feel a lot of intoxication, we can see intoxication. And one thing here we need to remember is, when we drink alcohol, you don't digest alcohol. It passes quickly into the bloodstream and travels to every part of your body. So next slide. And so when it happens in that way, it affects first on the brain, then on our kidneys, lungs, and liver. So the effect of this depends on the age, the gender, the weight of the person, and also the type of the alcohol they are consuming. If you see here, most children and young people are smaller and weigh less than compared to adults. So alcohol can affect the youngsters, very fast and very quickly. Children and young people's brain are still developing, so even small amount of alcohol can cause a lot of damage. So let's go into the next slide. So here, similar to smoking, let's try to understand why do some children drink alcohol. So it is out of the curiosity. So what is the curiosity? So I am growing in age, I am becoming an adult, I want to try something new things. So that kind of a curiosity. And also peer pressure. So some of the friends would be saying that, chalo yaar, ek do peck maar lete hain. So this kind of a thing is enormous during the teenage. And again, similarly, they feel that, it's a feel good, it may reduce the stress, it's kind of an enjoyment and relaxation. It's all just a feeling which is there inside them. If you see, and also sometimes they feel that to fit in. So in the social enhancement, if I have habit of having alcohol, they think that if I drink, I'm accepted in a social status by some of the people, elevated society. And also they feel older, like, they will have an image that now I'm looking being an adult. And also to escape from problems. Next slide. After knowing why, let's see that what are the influencing factors for drinking alcohol. So this is something which early introduction to alcohol, so as we have seen in the society, people, they would have in their parents or homes or etc. They are getting early exposed depending on the circle of friends, and their exposure to adults who drink excessively, and if they are having access to alcohol from parents at home, friends who drink heavily, and also access to cheap alcohol. Like if you see, some rural area side, if you go, we get arak, fermented toddy, the local made liquors. So all these are the cheap made alcohols. And alcohol marketing. It's not that marketing of an alcohol as a product. If you see today, the television programs or the movies, though they have a disclaimer, still the youth tends that, what is this in this? So that's the kind of alcohol marketing which is being noticed these days. And also the disturbed parental relationship, the truancy, the absenteeism, that is the absenteeism from the school, and the poor education achievements. So they get a low grades, so they get into the habit of, that is also an influencing factor. And excess of money to spend given by the parents. So they don't know how to, health-wise, better way to spend. So they may get into these habits. And conflicts or bullying, like the teasing, the peer pressure. And also, if you have a long periods of unsupervised time, these are the certain influencing factors which cause this. So we'll go to the next slide, please. So effects of drinking alcohol. So there are many, like, physical effects, psychological, short and long term. Let's see what are the physical effects. So it impacts the digestive and endocrine glands. They will see an inflammation in pancreas, inflammatory damage, so liver inflammatory, bloating, sugar levels get fluctuated ups and down, the central nervous system, like brain to the connected to this body, the various other parts of the body, the motor skills, the voice fluttering, and in the circulatory digestive system. So it brings out some gas, bloating, ulcers, a kind of makes you to feel the fullness in the body, in the stomach. Circulatory system, where the heart and the lungs get impacted because of this. And then skeletal and muscle systems, it have, the bone density gets down, the bones becomes, easy, fragile kind of a situation for getting into fracture mode. And immune system comes down, it weakens it. It also leads to pneumonia, tuberculosis, and certain stages to the cancer, various cancers. If you see the psychological effects, it has an impact on the memory and concentration, the impulse control, that means no forethoughtness, and the emotions. It has an impact on the emotions, the mood, the personality of the student or the child. Alcohol-induced bipolar, one time they will be in a depressed state, one time they will be in a maniac state. They kind of get into sleep disorders, the different depressive disorders, and also anxiety disorders. Let's go to the next slide, please. And if you see that in the short term, so as soon as they consume the alcohol, how does they feel? It have a drowsiness, giddiness, changes in mood, the lowered inhibition, that means they will have a less self-consciousness, impulsive behavior, their sluttered speech, voice, over the words, and nausea, feeling of vomiting, diarrhea, head pain, changes in hearing, vision, and perception, loss of coordination between body and brain, trouble focusing on making decisions, loss of consciousness or gaps in memory. We can call this as a blackout. So next slide, please. So these are the long terms, if you see, it's similar to what we have seen. It's the first change in moods, anxieties, a weakened immune system, change in appetite and weight of the body, problems in memory and concentration, tensions and conflicts arises in the family relationships, the bone density decreases, it affects the hearts and lungs in the circulatory system. So these are the effects. So going to the next slide, we'll see how we'll reduce these temptations. Next slide, please. So how can we reduce these temptations? So now a person, when he knows that he's got into an addiction and he wants to come out of it, he should plan ahead to stay in control. So first thing is, he should have something internally that I want to stop it. So that is the plan he should have. Then he needs to identify the two major triggers, external triggers and internal triggers. What are these external triggers? Like, the people, the places, the things, or the time which makes them to get into that alcoholic mode. So try to keep the temptating situations away. So which is comparatively easier when compared to internal triggers. Internal triggers is something, it pops up within the person. Now and then get an instinct that, okay, I need to have an alcohol. So this should be paused and divert the mind and develop some positive emotion, deviations. So this will help them. And remind yourself of your reasons for making a change. So why you want to make a change? For a better life, for having a successful life, for having a happy relationship with the family. Talk it through with someone you trust. So when you feel that it is difficult for you to stop, have an interaction with the person who have a trust and take their support. And distract yourself with a healthy alternative activities. Like, doing exercise, swimming, cycling. There are various other healthy activities which you can develop. Next slide. And also challenge the thought that drives the urge. See, we human beings we have a lot of power, willpower within us. So if we challenge to ourselves, we can do the drive the urge for creeping away. Ride it out without giving in. And then also leave the tempting situations quickly and gracefully. So like somebody is trying to offer you, please say that, sorry, excuse me, I'm not, I'm fine with this. So that way of kind of leaving, gracefully. Schedule activities that don't revolve around the drinking. Avoid places and people where, they will question your willpower. And also change your friends group if you feel that it insisted for stopping your alcoholic habit. So these are the ways of, reducing the temptation for alcohol.
Thank you so much, sir. So now we are left with only 3 minutes into this session. So I'll ask Venkatesh, sir, so quickly educate us about the remaining thing on this session today. We only have 3 minutes.
In fact, since we have very little time, I'm afraid we may not be able to cover what we had planned. But let us understand that even the drugs or internet addiction, for that matter, that we talk about, these are all different types of addictions. Now, what are the takeaways? Let us quickly come to the summing up of the takeaways first.
Sure, sir.
One, there are different opportunities. Let's come to the last slide. Last slide.
Very last.
There are last one. Yeah. No, before that.
Next slide.
Before that. Before that.
No, sir. Next. Last.
Yeah.
Still.
Next.
Could you go next?
Next.
Yeah.
Yeah. There are several opportunities which children get tempted. Opportunities are a very big villain, according to me. There are conducive atmosphere for these kinds of addictions. Friends who can seduce you are a very big source of addiction. I should know who are well-meaning friends, in whose company I can benefit, in whose company I am likely to get seduced. I should know. Then the third one is availability of the easy money. Many parents think that we are all busy, we don't have time. Let us give money and compensate our, our paap pragna jo hai ki samay nahi de pa rahe bachchon ko, paisa de de. I think that is one of the worst things that we are doing to our children. Availability of easy money, children will not know how to use that. It can seduce anyone. Unsupervised use, spending quality time is a solution to many of these things. Many of the parents are not in a position to supervise their youths. So unsupervised youths are much more vulnerable to all these addictions. Then next is the adult wrong models. There are adults also who provide wrong models which can impact on the young minds, and schools have a very important role to play. So if schools, teachers, management wants to take this issue very seriously, there can be very many things which are possible. So with that, we come to the end of our presentation. We have cut short because we started late, and I'm sure you will appreciate that these takeaways can help us. Schools have to be more serious in taking these issues, and the school guidance program has a very important responsibility of working for prevention of so many such bad elements and bad behavior among children.
Definitely, sir, and thank you so much for this informative session with us today and sharing this knowledge with us and with our viewers today. Thank you so much, and once again I would like to thank both of our experts today for joining us and for this informative session. Thank you, sir.
Thank you very much. Thank you.
And with this, we come to an end of this session for today, and you keep watching NCRT Official and PM eVidya channel. Namaskar.